Hi.
Evening.
Hi.
I'm Shivanika Pal. I'm principal Vidya Bharati School.
Okay, so you are the co-panel.
Ma'am, we have to start the session now.
Yeah.
Thank you.
Yeah.
Good evening, everyone. A warm welcome to the 10th webinar. Good evening, everyone. A warm welcome to the 10th webinar of the webinar series on adolescent and youth. I'm Sharon Augustine, moderating the webinar with my colleague, Aliza Hassan. Like every webinar, here is the pre-survey form on your screen. Kindly fill the pre-survey, and it is also open for the panelists as well. Thank you.
Yes, correct.
Good evening, everyone. My name is Aliza Hassan.
And I am Sharon Augustine, moderating the session along with Aliza.
Let me introduce you with SHARP. SHARP stands for School Health Annual Report Program. It is a pan-India non-governmental health organization, and we have recently completed 21 years in the field. We work for the healthcare of students and children, which is professionally managed by psychologists, nutritionists, educationists, and people like you and I who have vision to promote healthcare. So our sanitation and hygiene program, we have reached more than 8 lakh people by working in aspirational districts. 2.5 million school children has been touched, more than 5,000 Anganwadi workers, 2,000 teachers in more than 65 cities.
To celebrate the Swachhta Day, we are here to discuss the Swachhta Action Plan for preschools and schools during COVID-19. With COVID-19, we all are facing a kind of uncertainty of steering through these hard times while caring for our physical and mental well-being. The reopening of the school during this time will be a challenge to school authorities, teachers, and parents to practice the component of wash to prevent the spread of COVID-19 among the students. We as a public health organization, it is our duty to reach every nook and corner of the country through our public health activities. And this webinar series comes out of one such dainty effort.
COVID-19 pandemic has left a very big room to discuss on the wash practices, importance of wash practices in the vulnerable communities with the vulnerable children and students. So for the same objective of discussion, we have with us the esteemed panelists, Ms. Urvashi Prasad, Mr. Ramchandra Singh, Ms. Meeta Jarohar, and Ms. Sovanika Pal. We welcome you all.
Uh,
Thank you, Alisa. Thank you, Sharon.
Thank you so
Thank you,
much.
ma'am. A few instructions before we start the webinar. We will let all the panelists speak first and then take up the question. Please drop your question in the Q&A box with the name of the panelist. We request the audience not to fill the chat box with unnecessary messages because we tend to miss out the important question. So let's begin the webinar. Our first panelist for the day is Ms. Urvashi Prasad. She has an extensive experience in health, nutrition, sanitation, gender, and public policy. Over the last 3 years, she has been working as a public policy specialist in NITI AAYOG. She was a member of the core team in the Vice Chancellor office that prepared the strategy for New India at 75, released in 2018. She has also co-authored the government's 3-year action plan released in 2017. We welcome you, ma'am. Over to you, ma'am.
Yeah, hi, can you hear me first of all, just to check
Yes,
on,
ma'am.
yes, okay, great. Okay, so thank you very much for inviting me for this. I'm just going to start off with very brief remarks on the sort of immediate COVID situation and how that relates to WASH in schools. And then of course, subsequently, perhaps we'll have more questions on this also in terms of broader WASH policy and, what we need to do and what we have priorities for the future. So I think at this point, you put it out, right at the outset that it is a very challenging time. When we look at schools, and WASH is indeed a very, very important component of, ensuring that the infection spread is minimized. And that, of course, has to be a very important imperative at this time. I mean, yes, we are opening up schools, and that is to sort of try and get back, our education space, where obviously there's been a big disruption. But health remains a big imperative, and we have to balance it out with that. So I think, India, we know, is very diverse in terms of its WASH infrastructure in schools. Even where there is infrastructure, there is a lot of variability in terms of functionality. So I think there is a whole hardware, set of issues when it comes to water facilities, hand washing, toilets even. So I think that is there. Now, a lot of it, unfortunately, might be a little more longer term. And to address it in the immediate term would need a lot of collaboration and resource mobilization from across stakeholders. Obviously, the school by itself or even the local government administration by itself might not be able to manage, given the sort of urgency of the situation right now. So, of course, it is very important that there are, collaborations that are forged at this time across civil society, across you have UN agencies, you have corporate social responsibility. So whatever can be done, and of course it needs a little bit of out of box thinking as well in terms of how to address some of our longer term or more systemic issues, given that we are in a crisis situation right now. So I think that is for one part of schools which might have a huge deficit of the hardware part. But I think the other part is really what pertains to all schools, and that is the software aspects of WASH, the behavior aspects of WASH. And it's really important that adequate training is carried out for the educators, starting right from the school management, teachers, parents and students, of course, have to be involved. And for students, it would have to be age appropriate training, because we're also talking of preschools here. We're talking of very young children here also. And then we are talking of, much older children and adolescents. And so I think that training is really very, very important. And of course, it need not be very elaborate at this time. It's, as I said, it's a balance between speed and how much we can cover and how comprehensive we can be. But it's important that we cover at least the basics of hygiene and distancing and hand washing at this time. And also, I think just putting in place the monitoring systems. I think that's what I would say, that, we all know the basics by now of what to follow and, what not to, but how to really monitor that, how would the protocol in the school work, right from when children enter the school to when they go out, and, what happens in between, and who really monitors all of that. I think just having very clear protocols for that in place would help. So I think these are just some brief, sort of remarks for this immediate situation, and then I'll be happy to touch upon other aspects as well as we go forward. Thank you.
Thank you so much, ma'am, for sharing your views. So now I would like to invite our next panelist, Mr. Ramchandra Singh. Presently, he is working as a consultant Washington Institutions, UNICEF India Country Office. He is a postgraduate from TIS in rural management, having a rich experience of 20 years and 8 years of key experience in sectoral, in sanitation, watershed management, education, preschool, women and children. Over to you, sir. We are looking forward. You are not audible, sir. Is the audio connected? No, I cannot hear you, sir. Sir, is it the audio? Have you joined the audio in the bottom left? We are unable to hear you, sir.
So we cannot hear you now.
Sir, would you please mind to connect again, like your connection, or just exit and enter the platform again? Just try that once.
By that time, we can go to our next panelist. And our next panelist for the day is Miss Meeta Jarohar. She's currently working as the Regional Program Manager East with Plan India. She has 15 years of experience of working in increasingly responsible position with government, corporate sector, and national international NGOs like Water Aid and USAID, focusing on the component of nutrition, health, and sanitation. She's also the national trainer on WASH with National Institute of Rural Development. Thank you, ma'am, for joining us today. We welcome you, ma'am. Over to you.
Thanks, Sharon, a lot. Greetings to all of you and my co-panelist. I think I would like to put my views towards, to opening the discussion regarding how best we can prepare in terms of putting our institutions, especially Anganwadi centers and school, pre and post COVID. Plan India, presently we are working in 10 states, and school and Anganwadi level intervention is one of the intervention, because the core value of our working is related to child. The situation of COVID, you see, it was such an alarming situation for us, because if you see the evaluation of the whole WASH sector, right from the school sanitation and hygiene education, which was a component of total sanitation campaign way back in 90s, in 2000s, then also hand washing with soap, uses of toilet, always been an integral part of all this national shift program to which states, NGOs, development sector was acting. So the word hand washing with soap, the word uses of toilet, the word solid waste management was nothing new to the sector. But sometimes it happens that some wash behavior, what I felt is so much intrinsic. If I ask you, do you wash your hand, you say yes, I have, but you have not. It's so intrinsic that is so difficult to measure. We can see there's a hand washing station, we can see there are toilet, SBM have contributed a lot, but still a large population of our society really need to integrate all this practice in day-to-day life. I would say post-COVID and in fact pre-COVID, because when the schools are open, children are there. I mean, I hope, the teachers and principal can understand, because that time they don't have, get the time to act. So they have to put the school mechanism pre-opening the school so that the children are safe. So I think two component we as a development sector partner should look at, and we will be also looking at in our intervention areas. One is hardwares. If you see India, I mean, we are always populated country. You go to a school, you go to a midday meal program, you go to a toilet, you will always find the infrastructure is less and the student and the users are more. I'm not coming in the functionality part of those infrastructure. The numbers are always more in the country like us, that when you say you have to practice physical distancing, it will be a challenging thing for school administration, no doubt. I mean, if first the challenge that they have a hand washing station, second challenge they have the agents in the place, third the challenge they are functioning. And if these three are functioning, then you know how they are going to manage the children, because at present we do not have a staggered mechanism of classes or intervals. So the whole system in which we were working, and post COVID, how it will work, because it won't be easy for any administration or state government or the school to come up with a new set of hardware so soon, and that to adequate in terms of number of the students or teachers. So these things we have to really look at, and the best thing to the start in our experience would be start off with a local solution at the school level. I mean, principal has to really think with SMC teachers, children, that how they are going to manage if 400 or 500 children come to their school with that very infrastructure. And they are having a responsibility that those children don't get infected when they are coming to the schools. So given a condition that overnight the hardware situation will not change, it will be there. So with that existing setup, what are the local solution we can come up with so that the teachers, children, they all are safe? So that was on the hardware part. Second, on the behavior part, we had a project. We had many projects, but this particular project I want to talk on, because we use behavioral thing very casually. But this project I wanted to share that it has really shown us the improved behavior, because the program design was done like that. It was not a general design. It was a very well researched and the program design to make things simpler. And when we compare this program, we find that yes, 1, 2, 3, 4 behaviors of those children, of their mothers, have really changed. And children should enjoy washing hands. They should not be, out of fear ki hame COVID ho jayega kind of thing. You should enjoy practice like washing hand and hygiene practice, which give you a more quality health life. So if the time limits allow, then I can run few slides which I have shared to your team. Yeah, so this is about the project which we had, and we see that few behaviors have increased. We had a pre-situation, we have a post-situation, we have a middle level analysis to see that what makes children to enjoy and adopt that behavior. I'm not talking on awareness and education part, which largely all of us do. I'm talking about the behavior part, the outcome of this intervention. So we can go to the second slide. Yeah. So this project, we did it. It was a pre-COVID project, and we did it in Odisha and Jharkhand state. And the problem was of that area of our intervention, that this community were like, again, intrinsic behavior. I wash my hand, but actually I don't do. I use my toilet, I say, but actually I don't do. So we had an observation kind of thing that, these practices are not there at the, or less at the community level, at the school level, at the Anganwadi level. We have seen a village as a micro unit. Village where household are there, so you have to intervene with the community. A village where school is there, so you have to intervene with children. A village where Anganwadis are there, so you have to intervene with mothers. So all three subsets, we interjected our intervention of the project. Next slide, please. Yeah, so the 5 behaviors I would like to talk here, which a school has to face or regularize once they open post-COVID. One was on the use of toilet, because we see that many children in those schools were using toilet, not using toilet, especially not using urinal because of number of things. I mean, less number, water, stink, cleanness. they were not using, but post our project, there was a progressive improvement toward the use of toilet, and also them reporting to the school management committee, the principal, ki haan, aaj ka nal kharab hai, aaj ka toilet kharab hai. So that thing was also improved. Second, please. Second, please. Okay. And second thing, at the community level, we try to lens out that every member is using toilet or not, and what is the situation pre and post project, and also that the child disposal practices of toilet. Again, seeing a village as a total with the school level, Anganwadi, and the village level interventions. Next, please. Next, please. Yeah, so we have tried to unbundle the critical occasions of hand washing. If you can, if the children of a primary school, if you say that, you have to wash and at 10 points, they will forget. So we have crystallized based our need that there had to be 3-4 occasions. Keep on telling them, keep on telling them, keep on showing them. Then we have seen on that occasion, it has been increased. So my key take is here is that any behavioral change is important to address situation like COVID or any infection, but then you have to be very crystal clear in what behavior and what occasions you are talking. You cannot talk about 20 occasions because human psychology don't retain those. So you have to filter it out for any behavioral change program. So we filter out in 5 occasions. Next, please. And again, one thing we found very interesting, because we go to the school, we see hand washing session there. Every children was washing hand, and they saw us as an outsider. There was a big line in MDM during the midday. They were washing hands, but when we went to the close side, there's no soap, or a very tiny, kind of fading kind of soap they were using. So that is also monitoring mechanism. Don't go by what people are saying. You have to really see that what they are washing hand with. Is it water or is it soap? So that was also a progressive thing. So next, please. Yeah, so I mean, these 5 behaviors have increased. They have increased. Then what was the software design of the program? I would like to put it here that we have made it a 5 level of change. When you are talking to a mother who is not very much literate, I will not say educated, not very much literate and bogged up with number of household responsibility, cannot give you time, or a children who is already bogged with number of educative session. So we try to design the program where we have made a thing understood, we have made thing easy for them, we have made thing desirable and rewarding for them, and we integrate with the Swachh Bharat Swachh Vidyalaya program where we have dealt with SMCs, we have dealt with teachers, we have dealt with block officials to make this behavioral change. Next, please. Yeah. So the program basic, I mean, the concluding slide is this, that the program delivery of 8 weeks was divided into these 4 pillars of behavioral change. That is awareness, making them aware, commitment, raising their commitment, reinforcing. I mean, for one time I'll say you wash your hand, you will not do. I have to reinforce you in a regular set of time. So reinforcement and reward. I mean, who perform should be rewarded. So this was an eye opener for us because, when COVID came and NFHS data shows that still 30 to 40% of hand washing practices are there, then this is the field where we have in Odisha and who has almost 90% of the behavior of hand washing. I think when the school open, I mean, hardware thing has to be built, obviously, but for the software thing, we have to design such kind of program in which children participate. Is an easier thing, and they enjoy hand washing, they enjoy use of toilet for quality life. So that is on my part. Definitely will be contributing more to the course of discussion.
Thank you so much, ma'am. I really like the idea of these 4 pillars and how important they are to bring a change, what difference they can make. Thank you so much for such a powerful presentation. And thank you. I would like to invite Mr. Ram Chandra Singh. Sir, are you able to hear us?
Yeah, can you hear now?
Yes, yes, yes.
And it is fine, I think so. Yeah.
Yes.
Thank you. So should I start now?
Yes, sir.
Okay. Thank you, and it's a pleasure to be here with and connected with the teachers and the Anganwadi workers all around the world, around the country. My co-panelist already set the background, so for me the task is very easy now. So let's go ahead with the Swachhta Action Plan. This is something which is a topic given to me. So I will start with the screen and my screen share, and then we'll talk later in some aspect of Swachhta Action Plan, especially in schools and Anganwadi.
Okay,
Right?
sir.
So I'm sharing it. So given the limited time, so I should stick to the basics only and about the Swachhta Action Plan right now. But the COVID context has given it's a new dimension right now. So what we have been doing earlier now need to be thought in a different perspective, and what extra we need to yet strengthen the things in Anganwadi and the schools. So context is very challenging, as already said by our previous co-panelists. So for me, and even as an Anganwadi worker or a teacher, it's very important that we make it, we bring the whole focus to the child and the service users. So at the center, the service receiver, or we say the preschool education, not only the children, but also the adolescent girls and also the woman, the mother pregnant who come there for different kind of services. So we need to keep all those things in mind whenever we have a plan, especially for the Anganwadi or the preschool education. But for school, it's a little different context. So key actors like the participant today, teachers, Anganwadi worker, Anganwadi helper, they have to take a good support from the stakeholders, parents, caregivers. They have a big role because child mostly stay with them, and whatever etiquettes they follow, there is a good weighting of the parental support and also the support which we get in the school timings or the Anganwadi timings. So we start with what we've been doing earlier. These were the key components we are focusing in terms of the WAS. So basically it is drinking water, sanitation, hand wash facility. I just reading it here for the sake of time. Solid waste management, food safety, hygiene, and because there are the provisions, so something has to be done for the operation and maintenance. They remain functional all the time. But apart from that, as already said, the hygiene and health education, the software part. So both are essential. So neither can work alone. So for me, it is very important as a school, do we have enough provisions, but at the same time, do we also have the approaches how to go about the behavioral aspects. But this was what we are doing. Now we are expected something more. So for that, so we need to check on these issues. So mask is probably for the Anganwadi preschool center, especially for the Anganwadi worker and the helper, not recommended for the under 5 children actually. So we need to be very careful about how to practice these during our like Anganwadi duration, and also keep most of the outsider, like the movement should be very much restricted to avoid the spread. So physical distancing and the airflow. Apart from the WAS, we need to see whether the Anganwadi or the school have enough ventilation, or if it is not there, we need to check it the case. So respiratory hygiene, environmental cleaning, disinfection, SOPs, even for the case management, in case something happens, some special children or somewhere, we find that there is a case symptom, or there is someone is unwell. So what need to be done? So these are the extra things where school or the Anganwadi need to take a little more cautious decision on that. But at the same time, what I am seeing it's not only knowing about the parameters, but exactly going in depth with that is that much important for the planning. So far as what drinking water is concerned, so what need to be like kept in mind is, do we have enough water? Do we actually know what are the norms? Like if there is one children or the Anganwadi worker or the helper or the teachers, they require water for different purposes. So what is our daily requirement actually? So unless we know the norms at the state level or at our Anganwadi level, we not estimate what is the requirement. And once we know the requirements, then only we used to know, we can have an idea, so where we stand in our Anganwadi and the schools. So that is the first thing probably we need to check at our levels. So for each of these parameters, and apart from the provisioning, suppose we don't have a hand wash facility and we expect children or the Anganwadi workers to wash their hands. So we have to be little careful about that, how we can do within a short time, but with minimum resources we have, because resources are very scarce, but somewhere the teachers and the students find them in a good resource setting, but mostly the government school has a challenge. So these parameters need to be checked. That is what I meant here. So emotional support, nurturing, and the learning opportunity, all these should be kept. That is the vision in our mind, that for the children is the first step where they come to the Anganwadi center. And once they feel like home, then only the things go the way we want, right? So in that sense, a kind of visioning, a kind of capacity building on our part is required for the Anganwadi workers, and they need to be self-motivated, the preschool education teachers also. So what exactly we are actually looking in a Swachhta Action plan, I'm just focusing on the processes. If some school, some Anganwadi, because it varies from school to school or the Anganwadi to Anganwadi, the context don't remain the standard. So,
Right, sir.
So in that sense, so we start with the parameters, like for the water, for the sanitation, for the hygiene. And for the time being, if we don't have enough of the water, enough of the urinal to really have a safe distancing, so we need to think these are the critical parameter under each of the components. So once we are listing that, so that is the first step. We exactly know what should be there. So the second step could be the compliance of the Anganwadi centers. Do we really complying to those requirements जो हमने अपने लिए निर्धारित किया है, क्या वहां पर हम लोग पहुंचे हैं कि नहीं? That is the point where we need to check on the very first time. So we have to have a very minimum level of, like, these are the 8 to 10 or 3 to 4 things in the waters. Those are really required to start it with safety. So safety is the first thing for this time. So now we come to the small and or sometimes it is a last intervention. So we need to identify what are the activities, what are the action points we are going to take in any of the case. Be it drinking water, be it anti-aging, be it toilets, be it the software part, the hygiene education, the curriculum need to be redesigned, reworked according to the children, their language, whatever it is. Now the address level is there. So sometimes we find that ourselves, we don't have much resources. Sometimes Anganwadi worker and the teachers, and what the experience we have in most of the cases across the states is 70 to 80% of the small requirements that can be dealt at the panchayat level itself, within the village level. So it's not always a big challenge. So we need to be little cautious about and how we go about it. Once we know the level, it is a gram panchayat, it is a panchayat, or we need a support from the block level or the district level, we need to find the resources with the convergence with the panchayats, and there are enough resources actually. But we need to prepare ourselves what we actually looking forward. So once we pitch it very rightly, there are support available even at the local level. So now we have to be very specific on the responsibility. If we just have a plan and it is kept in the Anganwadi center of the health or our school, so that is just for having a plan. So now it should be discussed with the community, with the school management committee or the panchayats or the urban local bodies. So how to go about this, how to prioritize this. So a timeline is also very much required. So I think these are the processes which looks to be a little like 6, 7 to 8 steps, but they go on very simultaneously. And this all is then become a part of the school level Swachhta Action plan that considered all the water sanitation, hygiene related points, even the infection control at this point in COVID-19 policy. So it's just a view of the plan. So we have on the left-hand side, the component of a particular essential, probably water. So we need to know, do we have a source in our school that is very much dedicated? So yesterday only on 2nd of October, so we had this 100 days campaign launched now from Ministry of Jal Shakti. So this is a great opportunity for water. If you want a running water in our Anganwadi or the schools, this is the right time. we should make efforts at our level, because next 100 days are going to be very important. This is one good opportunity that has been brought very recently, but now last 2, 3 years, 4 years, I haven't seen such kind of a big movement going on, especially for the Anganwadi. And so those are the gaps we can always address with our engagements. Quantity of water, what kind of storage we require. So we know the parameters, but on the second side, we have to be very much specific if we really want to change the things on that part for the Swachhta Action Plan. So now this is my last slide. So this is what I was discussing, that there is a 100 days campaign, especially for the water, and many of our facilities, even Anganwadi and the schools, don't have a running water in the toilets. But sometimes we also find the toilet don't have good, like enough ventilation, enough light that the children really want to go inside, or those are really functional enough. So how we should go about it, we should feel what the children should be feeling all about that. So keeping the children at the center, keeping the Anganwadi worker and their convenience, the center, how to do hand wash, those things we can always plan. And with that, this is what the approach we can really follow. We can have a quick gap assessment. We can have a performance plan. How do we improve? And then what are the essential requirements at this time, which is very much non-negotiable. Like if we have to follow the distance norm.
Right, sir.
So we have to be very much sure about these are 8 to 10 points which are not negotiable for us. If we start our Anganwadi, if we are very much sure for that, we can always prioritize and can have internal monitoring. And sometimes it is also an opportunity that we are planning for the long term. So it's not ends here. So COVID time at present is going on, but we are making a resilience for the long term. So this can go ahead, and over the time we can find which part of our Swachhta Action Plan can be dealt in what time. Suppose something like we don't have a water source, so that may take even 3 months or 1 year, but we shouldn't give up at this moment. So that should be in our plan. So this is what I have to say for the time. So sorry for taking a little more time than 5 minutes, but I think this is also like essential to go about it. Thank you so much.
Thank you so much, sir, for sharing such a bright insight. I would like to welcome our next panelist, Ms. Vanika Pal, principal from Vidya Bharati School. And this school is among the top 5 schools in Delhi as per Time School survey. She has been awarded ISA award from British Council, active participant of Swachh Bharat Abhiyan meal program, Clean Yamuna campaign, and various blood donation drives. She has also been awarded Savitri Bai Phule Samman, Dr. Rajendra Prasad, and Shiksha Ratna Award. We are looking forward for your views, ma'am. Over to you.
Thank you. A very warm afternoon to all of you. And I'm very glad to be part of this eminent panel. And thank you, Sharp NGO, for inviting me to share my school's policies on water, health, and hygiene. Now, if we remember that the Indian lifestyle has health, hygiene, and water in it right from the beginning. Now, our grandmothers, they never entered the kitchen without taking bath. It was a rule earlier that before entering the household, we used to remove our shoes and wash our hands and feet before touching anything. Now that old normal is now the new normal with a new shape. And this is what we have to teach our students now with the advent of COVID. Now, right from the coming of COVID in India, in my school and in all other schools, we have been sensitizing the children and the parents regarding the health and sanitization issues, the measures which would prevent the COVID from spreading here and there. Now, I'm happy to share that in my school, the preschool students, the nursery students are now in the habit of washing hands after and before the meal, and before touching any foreign object, and after touching any foreign object. Now, this has been, implemented, or we have made them learn this in a game way method. Now, taking into consideration that the children, they love water and to play with soap, we have taught them how to wash their hands in a proper way, in a scientific way, which they enjoy. Now, the area of maintaining social distance. The children, the preschool children, we have to make them understand again in the playgame method. So my teachers took the pain of teaching how to maintain social distancing by making them flap wings, by spreading their arms, and telling them this is the do gaj ki duri, this which would save them from coming across a COVID infected person. Now, this is another activity that we had taken, hop between one circle to another, again, which has taught them how to maintain social distance. Now, these children, they learn more through activities rather than theoretical practices. Our senior students, we have made it a practice in our school for the senior students to take health, hygiene, and yoga sessions for the junior ones. Now that keeps them agile, active, and their participation gives them a sense of responsibility. And when it comes to the students, at this point of time, they are totally away from their peers, their mental health, their emotional issues. They are, quite aggravated at this point of time. So what we have done, we have been taking classes, our teachers have been counseling them regularly regarding their emotional issues. We have taken workshops to deal with such matters, and even one-to-one talks are being, taken for them. Now, going ahead with Mr. Ramchandra, regarding the provisions and approaches that have to be made regarding the software, then these are all the things that we have been doing. Now, Ms. Mita Jaruhar, I hope I have spelled it right, has spoken regarding the hardware. Now, like most of the schools, in my school also, we have placed social distancing stickers in the entire campus. We are getting school ready whensoever it reopens. It's sanitization stations, hands-free sanitization stations have been installed in prominent places, in front of the classrooms, in front of the toilets, where the students can use, we have been teaching them to sanitize, wash their hands time and again. So they are already in the practice of, washing their hands, keeping the hands clean. Apart from these, we have sanitizing doormats, which are very interesting things which have come up over the advent of COVID. I had never seen them beforehand, but they are very much useful and functional. So we have placed all these, hardwares and making the school ready for the children, whensoever it opens for the children, to be safe and secure and maintaining our hygienic conditions. Now, regarding the SOP, under the SOP of, you can say, the reopening of the school, what will be done and how it will be done. So under the guidance of SMC of my school and in association with my teachers, PTA members, and seasoned students, we have planned out certain things. We have been talking to the students, talking to the parents in particular, that whether they will be allowing the students of class 9 to 12 to attend the school. And not many have agreed, but few of them, they have agreed. And on talking to these parents, we have come out with comfortable timings of having 2 batches. Now, say from 9:30 to 11 and from 12 to 1:30. Now, staggered timings, staggered entries, and in between, when the one batch leaves, then the entire school would be sanitized with disinfectants. The toilets will be sanitized, the toilets will be cleaned. And when talking about toilets, we earlier also had DDs stationed over in front of the toilets to guard the students come and go. Now we have instructed the DDs to be all the more watchful regarding the entry of the students. We will not, the DDs have been instructed not to let the students, enter in say 3, 4, 5 numbers. Whatsoever the cubicle number in the washroom, the students will be, entering according to that. And the hand washing stations, they earlier had, soaps and soap dispensers. Now, automated soap dispensers have been stationed. Now, apart from these, all these things, now the wearing of mask, whensoever the children come to the school, that would be a mandatory thing. Now, we have been talking to our parents quite very often to motivate their children to wear masks, because it is very habitual of the children, to remove the mask. अच्छा नहीं लग रहा, सांस नहीं आ रही तो मास्क निकाल दिया. So कई बार स्टाइल फिट नहीं होता तो मास्क निकाल दिया. So we have been, talking with the parents to motivate their children, to make it mandatory for their children to wear masks. Now, apart from all these things, as Mr. Ramchandra said, that what would happen if some having COVID infection enters the school. First of all, there would be thermal scanning of the whensoever they enter the school during the entry time. By chance, if in the the temperature does not show his the child is asymptomatic, then and certain conditions, the symptoms they show, then we have already debarked.
Ma'am, Suvarnika ma'am, can you hear us? I guess there would be some connection problem.
Sorry. And we are also in touch with the health agencies to whom we can contact if such cases they come whensoever the school reopens. Now, COVID for sure is not going to go in a short future. So it is the time that we adopt and adapt the new normal, start working towards it, and practicing habits, I would say, which would prevent us from COVID infection. That is all from my side today. Thank you.
Thank you so much, ma'am, for giving your insights on the SOP and how we can implement in the school. And I really liked the unique activities to bring the behavioral change among the toddlers and even the high school. Thank you so much, ma'am. So now we are beginning the Q&A round. And while all the panelists were talking, we have received a lot of questions from the audience. So now let's start with the Q&A round. So my first question is for Ms. Urvashi. Ma'am, what were the biggest challenges for Indian schools in implementing the Clean India mission or the Swachhta Plan Action?
Yeah, I mean, there's several challenges. I think these have already been covered in terms of the challenges. So I don't know, perhaps you want to touch upon another, because I think we've already covered the challenges in schools very extensively. So you might want to cover some other
Yeah,
questions now. Yeah.
if just pointing out some of the challenges that the audience get an idea of it.
Yeah, I mean, I think we've covered a lot in terms of hardware and software and behavior change,
Yeah,
training, access. I think so. So I think maybe we can take up another question. I mean, I don't want to be repeating
yeah,
what
okay,
all my
okay.
panelists have already touched upon.
Yeah,
So
yeah.
yeah.
Okay, so ma'am, what are the steps, like what should school proceed towards developing health curriculums with regard to COVID-19?
Yeah, I mean, health curriculums, I think, as I said, at this time, it has to be something quite quick and something quite fundamental, which covers, all the essential aspects. And of course, it'll have to be age appropriate. If we're talking of very young children, you might need something which is more activity based, which is more visual. If it's older children, then of course, you can have a different format there. But the idea is to convey the key messages of, basic hygiene, health, hand washing, distancing in our context. I think, again, a lot of my panelists have touched upon this. Distancing is not always the easiest, but yes, I think, as much as possible, following those norms. But definitely the face covers, yes, it can be something quite uncomfortable for children. I think for adults also, we don't see all the time adherence to face covers. Hand washing technique is very important. I think this is important even in non-COVID times. Unfortunately, COVID has highlighted a lot of the things that we haven't perhaps paid enough attention to before. And I think hand washing is one of them, where, the correct technique for how long you should wash. And of course, soap. I mean, often soap is an access issue also, and often running water is an issue. So I mean, again, all those are very much issues and challenges in many parts of the country. But even where we have access, adhering to the correct techniques and following the correct behaviors. So I think at this immediate time, the curriculum, it's more about keeping things simple, messages which are easily digestible by the children. It's a very stressful time, so you don't want to burden the children with too much at this time. There's already a lot going around. But just the very basics, at least, so that they, I think, have a good sense. And I think a lot of children, obviously, even during, whatever online classes or whatever else they might have done over these months, I think a lot of the basic messages would have gone out. But now that they are going back to school, how do they adhere to that in the school setting is what needs to be emphasized at this point.
Yeah, sure, ma'am. That the implementation, we have to see that how we can implement these whatever discussed today in the schools. Thank you, ma'am. So my next question is for Ram sir. So do you think WASH in Anganwadi centers and preschooling has been missed out all these years?
Yeah, preschool and Anganwadi is something which is not that much focused as washing schools been there. What I feel actually personally. At the same time, the ministry is doing at its level best possible, because there are thousands of Anganwadi across the states and the districts. So every district probably have more than 1,000 Anganwadi. So the scale is a big challenge. So sometimes these decisions are like decentralized. So in terms of WASH, there is no specific program. Actually, this has to draw upon from the convergence with other partners. Like we at the Gram Panchayat level, we find that this is left to the convergence mostly. So sometimes once we have constructed enough provision, and sometimes there is a challenge which already been said in this webinar earlier, that some Anganwadis are still running in a rented building. And at the same time, we find whatever the provisions we have, are they child friendly or not? Or they are user friendly in terms of like availability of water, like the children feel comfortable to use those. Hand washing is always a big challenge in even the Anganwadi centers, because small children really require a personalized support and emotional bonding. So how to go about it, particularly in this COVID time, because it's really challenging to work with the children rather than if you work with the student at 3 to 4, like 4 standards, So sometimes we need to stick to the basics, but at the same time, see the provisions are there. For example, every children not able to like herself or himself use a water container, water facility. So somebody has to assist it. So there are few children who can take it up. So we have to be very much having a localized plan. What I suggest, probably a lot is depend on how do we sustain, how do we maintain whatever we have, and how do we augment. So challenges are there, and we have missed a lot, and we have a lot opportunities to really cover up. So probably we can do it. With the government is also supporting now. Yesterday only this campaign of 100 days started with Mr. Gajen Singh taking this lead on this part. So everyone probably joined, and the vast condition, even in the Anganwadi, becomes little inspiring or encouraging for the children also. Thank you so much.
Sure, sir. Thank you so much, sir. So the next question is for Ms. Meeta. Ma'am, what steps have been already taken by the implementing agency to make the transition, and how can we make the implementation of all the preventive methods of COVID-19 in schools and Anganwadis?
I would say, look, implementing agencies, different degree of implementation agency. I would say what we are thinking to do to sync with the state government's SOP or directive towards helping school or Anganwadi to restore new normalcy, functions in new normal situation, and I think a lot of thing was also hinted by Miss Paul, that you have to don't wait for school to open. You have to, the first step has to be a preparedness for the SMC, for the teachers, for the active member of child cabinets, for the PRIs before the school open at the community level. And there are 5-6 measures which we need to think about, that when school is open, children are coming, what thing they need to do, or when Anganwadis are there, what thing they need to do. They are basic facility. They need a water to drink, they need a toilet to go, they need a hand washing station functional to use upon. There has to be a solid liquid waste management practices, for a proper hygiene. So this 5-6 parameter has to be focused by implementing agency, and come with a local solution with the support of school authorities, and come up with a plan, the Swachhta Action Plan, which was shown the format that really need to be filled and operationalized with the people contribute different part of it, mostly on Anganwadi, because if you see the ground zero situation, schools are yet to open. But Anganwadis are open, mothers are coming, children are coming for immunization. We, implementing agency, are generating community awareness that, they should come and avail the Anganwadi services. Government is doing that. So the basic sanitization process has to be fastened and expedited very importantly in the Anganwadi center, so that the mother and children who are coming for ICT services, for ANC, for immunization, should not get infected, should have a proper hand washing, should have a proper social distancing, that health practitioner practice, hand sanitation before they touch them or provide services to them. So that is how all the implementing agency are working, creating awareness, preparedness, supporting, and also some local adaptation to the hardwares.
Yeah, sure, ma'am. Yes, we really do. The Anganwadi centers are already working, and we really need to do the capacity building of the Anganwadi workers. You're really right, ma'am. Thank you so much. So over to you, Aliza, and please continue.
Yes.
discussion.
Urvashi ma'am, I have a question for you. For achieving India's SDGs in the coming decade, what should civil societies and government bodies focus on, especially in schools?
Yeah, so I mean, SDGs, I'll focus on the WASH related SDGs maybe. Otherwise, it might be quite broad. The SDGs, as we know, is everything really. So I'll focus on the WASH ones more specifically, given the context of the discussion. Now, in terms of WASH, I think obviously a lot has happened on sanitation, especially in the last few years. We've seen in terms of focus on increasing toilet coverage, and that is important, but that is really only part of the job. And whether it is at home, whether it is in school, whether it is in any other institutional setting, it's really important that the toilet is functional, the toilet is used. Otherwise, it's just a piece of sort of brick and mortar infrastructure. So I think the focus needs to shift on whether the toilets that we have already given, or households have constructed or schools have constructed, whether they continue to be functional, whether they continue to be used, whether they are gender friendly. I think I would really want to bring in the element of menstrual hygiene over here. That is something that I think we perhaps haven't touched upon enough. But I think menstrual hygiene management, right from the hardware aspects of it, to access to sanitary napkins for girls, to behavior change, to stigma. It's still a very taboo topic in many settings in the country. So,
Right, ma'am.
so I think that needs to be a huge priority for the government as well as for civil society. On water, I would say that yes, we are now talking of pipe water. We are talking of water quality, which is, again, it's the right thing to do. But we must not forget water conservation. And I think schools can also play a role in this, in terms of rainwater harvesting or whatever local solutions might work, because many cities in India, especially, we are in danger of water completely running out. So we are in a very sort of precarious situation. So we need to equally focus on water conservation, water management, use whatever locally available good practices that we have, as well as technologies. I think technology can also play a big role here in rationalizing our use of water in every possible type of setting, be it in the home, be it in a school, or be it in a factory. And then I think lastly, on the behavioral hygiene aspects, hand washing, I think we have really focused on hand washing a lot. But I think whether it's in COVID or in any other times, hand washing, I think, often doesn't get the attention. So I think the focus needs to shift if we are to achieve the sort of SDGs on WASH, and of course that will have a big impact on whether we achieve the SDGs in health, whether we achieve the SDGs in education, because if we know a lot of girls drop out of school because we don't have adequate menstrual hygiene management, we don't have separate toilets for girls and boys. So I think all these are very interlinked: gender, education, health, WASH. And here I think historically in India we have been a fairly infrastructure focused country, and of course infrastructure is still important. You need the hardware, you need the brick and mortar, but let's not forget the behavioral aspects, and let's not forget the softer aspects. And I think that's really what I think we need to focus more on going forward.
Thank you so much, ma'am. Very well explained. And okay, my next question is for Sir Ram sir. What are the cost-effective ways of maintaining high-quality sanitation and hygiene so Anganwadi centers and preschools benefit from it?
Okay. Probably like it start with the designing of the facility itself. So whenever there is a new Anganwadi being constructed, so it has a proper design and proper arrangement for the water provisioning, for the toilet, for the hand wash facilities. So we can start with that point only itself in future, that if there is a new Anganwadi coming up, so do we have enough adequate, and whatever we say it's a child friendly or adolescent girl friendly, so are those things visualized at that stage, and not by the government itself in its letters, but at the field level, the person who are implementing it. So how much we are concerned about that is a big question. And at the same time, being an Anganwadi worker, being a teacher, to what extent we have our role in that part. So once things are done wrong, we can't make it right at later stage. Suppose the slope of a urinal is like the floor is, the slope is constructed in a different way, but later we can't help it out. So those are the areas we need to check upon. And at the same time, the existing Anganwadis, so we have to identify which are the areas which are preventing our children to use it, to enjoy the facility, or to really feel like that they are at home. So that sense of ownership, if we have in our Anganwadi centers or the school, we can always, it's not a challenge to find out the gaps, and always gaps are like, it's not that difficult to also, if we have a proper plan. So one of the big challenge that I find that we probably have a listed items which are probably required for a good WAS compliance. And if any of our facility have any such plan, they should share among themselves. So there are good practices around, but mostly they are not disseminated in other sense, like how to build on what we already have. So that is one priority. So a lot more can be done, and first action plan is very new concept. It's for Anganwadi itself. So let us see how it goes about. Thank you.
Thank you so much. Urvashi ma'am, a very quick follow-up question from you. After construction of toilets, what should be the next policy building focus for India's WASH-related goals?
Yeah, so I think, of course, some of the things I mentioned in the previous response, but I'll add on also the waste management aspect. I think that's again a rather ignored, or I would say area we haven't given enough focus. Ignored is perhaps too strong and unfair a term, but we haven't given enough focus. And I think partly it's a natural progression. I think you start with the very basic. So you start with, okay, does everybody at least have a toilet? Let's start with that. And then we keep moving forward. So I don't think it's, anyone's fault really, but it's a natural progression of how we move forward. So now that you have a toilet, now you think about things like, the waste management. So of course there's fecal sludge management that we have to look at. We have to look at wastewater treatment and reuse. And that's where I think technology can play a big role.
Right.
And the government needs to see how can we bring some of the cutting edge technologies, including startups. Startups are doing a lot of innovations in these areas. Right. So how do we bring that to scale? Single-use plastics. I think single-use plastics is another area that we need to really focus on, because of course we have a goal for the country that the Prime Minister has said that we want to eliminate the use of single-use plastics by 2022. So we at least need to start, moving towards that and taking very concerted steps. And solid waste management, and also things like segregation of household waste. So I think we need to keep moving forward. We need to keep building on whatever we have achieved, right, while ensuring that we don't slip back on what we have achieved. I think I like to keep emphasizing that constructing a toilet is not a one-time activity. You have to keep monitoring. Is it functional? Is it usable, etc.? So while you keep monitoring all of that, I think you keep adding on these additional layers to it. Including the menstrual hygiene management. I always really like to emphasize that.
Thank you so much, ma'am. Vanika ma'am, would you like to add something to the subject?
Yes, ma'am. The thing is that what do we do regarding the behavioral changes that the students would be encountering, right now and after the reopening of the school? Right now, the children, they have taken to the comfort zone. They are, very comfortable. They have comfortable times and they can wake up the way they want. The online classes, jokes are there that the online classes are going on with just the, student being present, but the video is off. Now we do not come to know what is the student doing at that time. So And as the students are, confined to their homes, they, as I had said before, they have lots of mental stress and emotional discomfort at this time. So what we have been doing is that we have started to put our children in a routine. We have started assemblies, early in the morning. And that is a virtual assembly, as we all know, but we mandate that all our students, they participate in the assembly with their videos on in their school days. At least they are getting up on time and, getting used to the school routine. We are also making them, participate in yoga asanas, in health practices. Recently, under the Freedom Fitness Run, we made our students cover approximately 2,734 kilometers, right from their homes, on the roof terrace or in their gardens. They ran, they calculated the steps and they sent the videos to us. It was a part of the CBSE curriculum, CBSE program, but then also we made sure that our students, they remain healthy and active. And we make them, practice yogasanas also. Now, we all know the benefits of yogasanas, but we have, discovered that even the little ones, if they practice yoga asanas, then they, maybe they are very agitated at this time, but they come out to be calmer, little composed, less crankier. So these all things I wanted to add at this point.
Thank you so much, ma'am. My next question is for Meeta ma'am. How the negative outcomes of mismanagement of menstrual hygiene practices amongst schoolgirls should be tackled?
Actually, no easy solutions. Though in field we see that school department, education department, and SBM has invested in installing incinerator or vending machines. But there are a lot of environmental issues also to this disposal mechanism. So I think, we have to really come up with the solutions nowadays. There are ministry guidelines. There are some of the INGOs that are coming up with more organic waste of menstrual or products. But this thing is an area which needs to be strengthened and innovated also. If you see the NHM guideline, they say there are 4 accepted wayouts to dispose sanitary waste, which is dumping, which is digging, which is incinerator. But in field, it is not picking up. In the general practice, that is thrown away here and there kind of thing, so creating a lot of problems. We have to come up with a solution which is environmental friendly, user friendly. This is a long way, because if you talk about menstrual hygiene, we have started education and awareness, supportive infrastructure and the disposal mechanism has, there are work to be done by different sector players.
Thank you so much. Urvashi ma'am, would you like to add something on the subject?
Yeah, I think, it is obviously, there's different aspects to this. One is obviously access to the sanitary hygiene products themselves and making sure that they are as environmentally friendly as possible. Now we have some options that have started coming out, including a lot of locally manufactured options. Now, of course, we need to make sure that they are also hygienic and they meet the sort of quality standards, but we do have those options that have now started to become available. Disposal, obviously one big piece of it, but that's where, if the pad itself is more environmentally friendly and sort of, degradable in a much more easy fashion, then that bit will also become easier. But I think the use also and the overall sort of stigma aspect, because, coming from a public health background, I know that there is a huge stigma still attached to this whole issue. So, being able to have open conversations around it and being able to sort of address those taboos will also be a very important part in sort of addressing the overall issue, because I think it's almost a lot of the other pieces we can sort of manage. But when it comes to the stigma and the taboos, that is something so fundamental and has gone on for so long that those become very hard to break. And there's so many myths and misconceptions, and you girls cannot touch this thing during their periods, or they cannot go here, they cannot go there. So we need to address it very holistically. And yes, there have been some steps, but I think they've been a bit piecemeal so far. And I really hope that going forward, we'll look at it as a sort of a more holistic solution to this.
Thank you so much, ma'am. Okay, we are ending our Q&A round here because of short time. We cannot take all the questions our audiences are sending. So thank you all the panelists, all the teachers, all the principals who have come forward to attend this session. It was great having you all, such active participants in the audience. Thank you, everyone.
Thank you.
Thanks a lot.
Karen, would you like to add something?
Yeah, thank you so much. We had a great discussion about all the topics, and we discussed about the challenges during COVID-19, the SOPs to be implemented, the design thinking approach to design the project, and also some of the SOPs which we need to implement in the Anganwadis also. And I thank everyone for joining today. We have around more than 500 to 600 participants. Thank you all for joining. I thank Urvashi ma'am, Meeta ma'am, Sovankika ma'am, and Mr. Ramchandra. Thank you for joining and taking out time for the session.
I would request 5 minutes from all of you. I would like to introduce a short video of how Haryana government is taking up standard operating procedures in times of COVID to reopen the schools and resume the routine by taking proper measures.
बच्चों की सुरक्षा और पढ़ाई दोनों को प्राथमिकता देते हुए हरियाणा सरकार ने माता पिता की राय तथा स्कूल प्रबंधन समितियों की मांग पर बड़ी कक्षाओं, विशेषकर बोर्ड कक्षाओं के लिए स्कूलों को आरंभ करने का महत्वपूर्ण निर्णय लिया है। प्रशासन ने सभी अध्यापकों का कोरोना टेस्ट करवाया है और आरोग्य सेतु ऐप सभी के लिए अनिवार्य किया है। सरकार ने स्कूलों की सुरक्षा से जुड़ी सभी तैयारियों के लिए समुचित मात्रा में धनराशि भी उपलब्ध कराई है। सभी अध्यापक और अन्य कर्मचारी स्कूल के फिर से खुलने पर उत्साहित तो हैं ही, पर सब इस बात का पूरा ध्यान रख रहे हैं कि कोविड की त्रासदी में बच्चों की सुरक्षा में कोई कमी न रहे। बच्चों के आने से पहले और स्कूल समाप्त होने के बाद पूरे स्कूल परिसर को हाइपोक्लोराइड से डिसइंफेक्ट किया जा रहा है। स्कूल परिसर में जगह जगह पर कोरोना से बचने के उपायों, संक्रमण की रोकथाम और उपचार की जानकारी देने वाले बैनर्स को प्रदर्शित किया गया है। स्कूल में विद्यार्थियों की संख्या को नियंत्रित करने और संक्रमण की स्थिति में उसे सीमित रखने के लिए विद्यार्थियों को अधिकतम 20 की संख्या के अलग अलग ग्रुप्स में बांटा गया है, जिन्हें बबल्स का नाम दिया गया है। प्रत्येक बबल का एक कलर निश्चित किया गया है और इस बबल का प्रवेश और निकास द्वार, पार्किंग क्षेत्र, शौचालय, कक्षाएं एवं अध्यापक निर्धारित किए गए हैं। इस बात का विशेष ध्यान रखा है कि एक बबल के विद्यार्थी दूसरे बबल के साथ सीधे संपर्क में ना आए और संक्रमण की स्थिति में सिर्फ संक्रमित बबल को आइसोलेट कर बाकी कक्षाओं को जारी रखा जा सके। हर रोज कक्षाओं के आयोजन और संपूर्ण संचालन के लिए विस्तृत समय सारणी भी बनाई जाती है। प्रत्येक अध्यापक खुद की स्वच्छता और बच्चों की सुरक्षा को सुनिश्चित करने के लिए ग्लव्स, मास्क इत्यादि के साथ ही स्कूल में प्रवेश करता है। इसके साथ साथ बच्चों के स्कूल में प्रवेश से लेकर निकास की पूरी प्रक्रिया पर बारीकी से ध्यान दिया जाता है और इसके लिए भारत सरकार द्वारा स्कूलों के संचालन के लिए बनाए गए मानक संचालन प्रक्रिया की अनुपालना सुनिश्चित की गई है। सबसे पहले प्रवेश द्वार पर बच्चों के जूतों को सैनिटाइज किया जाता है और फिर उनका तापमान चेक किया जाता है। अगर किसी बच्चे का तापमान निर्धारित सीमा से अधिक है तो उसे आइसोलेशन कक्ष में बैठाकर तुरंत उसके माता पिता और नजदीकी स्वास्थ्य केंद्र को सूचित किया जाता है। बच्चों के हर रोज के तापमान और दैनिक हाजिरी को रिकॉर्ड करके उसे ऑनलाइन पोर्टल के माध्यम से राज्य मुख्यालय और जिला मुख्यालय को भेजा जाता है। स्कूल में जगह जगह निश्चित दूरी बनाए रखने के लिए मार्किंग की गई है। टच फ्री सैनिटाइजिंग मशीन लगाई गई है। हाथों को धोने के लिए पैरों या कोहनी से इस्तेमाल किए जाने वाले नलों की व्यवस्था की गई है। कोरोना को देखते हुए कक्षाएं अभी खुली जगह पर ही लगाई जाती हैं। बैठने के लिए हर बच्चे की सीट का एक नंबर निर्धारित किया गया है और प्रत्येक बच्चा अपनी ही सीट पर बैठे, इसका खास ध्यान रखा जाता है। कक्षा के दौरान अध्यापक बच्चों से 2 गज की दूरी बनाए रखते हैं और कॉपियां चेक करने के लिए ग्लव्स और मास्क पहनकर एक एक बच्चे की सीट पर जाकर ही कॉपियां चेक करते हैं। साथ ही साथ अध्यापक अपने हाथों को भी लगातार सैनिटाइज करते रहते हैं। अन्य कक्षाएं जैसे लेबोरेटरी, कंप्यूटर क्लासेस इत्यादि भी बबल के अनुसार निश्चित दूरी का ध्यान रखते हुए ही कराई जाती हैं। बच्चों के लिए ब्रेक का कोई समय निश्चित नहीं किया गया है। बच्चे कक्षा के दौरान ही एक एक करके शौचालय जाते हैं। हर अध्यापक अपने विषय की किताब साथ लाते हैं और ये सुनिश्चित करते हैं कि अध्यापक और विद्यार्थी कोई भी वस्तु जैसे किताब या स्टेशनरी आपस में।
Thank you so much. I hope you all liked the session as much as we did. It was so informative. We have a short assessment to take, a post assessment. Please take that assessment. It will help us know more and deliver the quality and improve the quality of our webinar. So please take that assessment. And if you want to know more about our work, and please log into our website, or you want to log into our future webinars, please log into the website www.schoolindia.org, and the assessment will be right on your screen. You can play the video, Ritik, and then you can display the assessment.
Can I just make one very quick comment on use of gloves? I mean, this was a really nice video, and I mean, I really appreciate obviously the innovations, and it just shows so much is happening. But I think on gloves, I would just caution while whoever is listening, sometimes gloves can sort of lull you into a sense of false security. So if, as much as possible, actually, the ideal thing for ordinary people, because we are not people in health or medical settings, we are not medical doctors or surgical, we're not doing surgical procedures. So I think for people like you and me, as much as possible, washing hands, and if not, if you don't have the opportunity to wash hands, then sanitization might actually be the best options more than gloves, because A, they can sort of make you feel falsely comfortable, and B, you can have some cross-contamination, of surfaces, etc. So just a little bit of a caveat there on gloves, but I think other than that, I saw some fantastic things in this video. So yeah, I just thought I'll just put out that small comment.
Thank you so much, ma'am. Ritik, can you please complete the video and then we can go for assessment?
Yeah, sure.
कक्षा के बाहर उचित धुए हुए भोजन दिए जाते थे, इसलिए बच्चे मानसिक स्वास्थ्य का भी ध्यान रखा जाता है। ताकि अवसाद और तनाव उन्हें प्रभावित ना करे। इसके लिए स्कूल में उनके मोटिवेशन और काउंसलिंग की पूरी व्यवस्था की गई है। अध्यापकों के साथ साथ स्कूल के सफाई कर्मचारी भी हर वक्त साफ सफाई का ध्यान रखते हैं ताकि कोरोना का संक्रमण ना फैले।
मैं तैयार हूँ। मैं तैयार हूँ। मैं तैयार हूँ। मैं तैयार हूँ।
सुरक्षा के संग अपनाओ शिक्षा का नया ढंग। विद्यालय शिक्षा विभाग, हरियाणा सरकार की एक अनूठी पहल।
Thank you so much, Ritik. Can we please have the assessment now, a post assessment to do? Please take the assessment, everybody. Ritik, can you please pause this? Okay, so all the attendees who have participated, your certificates will be mailed to you by today, latest by tomorrow. So you will get all your certificates. Thank you so much for attending this sessions. We are done with all the post-survey assessments and your attendance. Thank you so much for present here. All the panelists for giving us so much of time. Thanks a lot.
Thank you, Alisa. Thank you,
Thank you
Sharon.
so
Thank you, Meeta Madam, Urvashi Ma'am. Learned a
Thank
lot from you. Thank you so very much.
Same
Thank
here,
you.
ma'am. Thank you so much.
Thank you,
Thanks a
ma'am.
lot to all of you. Thank you.
Bye. Yeah.